Quick question. Do you take ibuprofen, aspirin, diclofenac? Any painkiller more than twice a week? If you're over 60, your heart notices, even if you don't feel anything wrong right now. In Japan, we have extensive research on this topic. 20 years of data. Hundreds of thousands of patients tracked. The result? After age 60, these common pills change how your heart works every single day you take them. The risk increases 47%. That's nearly half. And most people have absolutely no idea about this. But here's what's important. There are safer alternatives. They work just as well for pain. I'll show you. Stay with me. In the next 10 minutes, you'll know exactly what to do to protect yourself. I'm Dr. Kenzo Arasato. For 38 years, I've worked with elderly patients in Tokyo and Osaka. What I'm about to show you is based on the largest study ever done on pain medication and hearts. This is not about scaring you at all. This is about giving you knowledge so you make better choices. First, let me explain something most doctors don't tell you when they write that prescription in 30 seconds. After age 60, your body processes medication completely differently than it did when you were 40 or 50. Your liver works slower now. It breaks down drugs at maybe 70% of the speed it used to. Your kidneys filter less efficiently, about 30% slower than they did 20 years ago. This is normal aging. So when you take that same pill you took at 40, it stays in your body much longer now. Think of it like this. Imagine pouring water into a sink. When you're young, drain works perfectly fast, but after 60, that drain is partially blocked. Water stays longer, builds up, creates pressure you don't want. That's exactly what happens with these pain pills in your body. They accumulate. They create unexpected effects on organs. Now here's the part that surprised me when I first reviewed this research 10 years ago in Tokyo. These pills, they don't just reduce pain and inflammation. They do something else quietly in the background. They make your body hold on to salt and water, like a sponge absorbing liquid you cannot see. When you hold extra fluid, your blood volume increases. More liquid flowing through the same vessels every heartbeat. Now imagine your blood vessels after 60. They're not as flexible as they were when you were young. Think of an old garden hose. It's rigid, doesn't expand easily, cannot handle extra pressure like new hose. So you add more water pressure from the pills, and your heart has to work much harder every single minute. This is why these pills increase risk of heart attack and stroke by 47% after age 60. But wait, before you panic and throw away all your medications right now, don't do that. Let me explain. Some people absolutely need these medications for specific conditions, and stopping suddenly can be dangerous too. Very important point. What I want you to understand is this. You need to be aware and make informed choices with help. Let me show you which specific pills we're talking about here. Pull out your medication bottles. Check labels carefully. First category, ibuprofen. Brand names like Advil and Motrin. Very common. Almost everyone has this at home somewhere. If you take this every day for arthritis or back pain, your heart is working harder than it should. Second, naproxen, brand name Aleve. This one lasts longer in your body, even more fluid retention than ibuprofen typically. Third, diclofenac, sometimes called Voltaren. In some countries, this requires prescription. Very strong effect on heart and kidneys. These three are called NSAIDs, non-steroidal anti-inflammatory drugs. They all work the same way, basically, in body. Now, aspirin is a different situation. It's also NSAID, but used for heart protection, often in low doses daily. If your doctor prescribed low-dose aspirin for heart disease prevention, Do not stop it without talking to them first. The benefit usually outweighs the risk in that specific case. But high-dose aspirin for pain? Different story completely. Here's what matters most. How often you take these pills makes huge difference in risk level accumulation. Taking ibuprofen once or twice a month for headache? Minimal risk. Your body can handle that occasionally without problem. But taking it every single day for months or years? Now we have serious problem, developing slowly and invisibly. In Japan, we did study on this exact question. Tracked 15,000 patients over 60 for 5 years straight. Those who took NSAIDs daily had 47% higher heart problems. Those who used occasionally, almost no increase at all. So the question becomes, if you have chronic pain every day, what do you do instead of these pills? This is the part where I show you alternatives that work. Some you know. Some will surprise you completely. Alternative number 1, acetaminophen, brand name Tylenol. Different mechanism completely. Doesn't cause fluid retention like NSAIDs do. For many types of pain, it works just as well as ibuprofen, especially for headaches and general aches. But there's important limit you must know. Never exceed 3,000 milligrams per day. Can damage liver above that. And if you drink alcohol regularly, be extra careful. Alcohol plus high-dose acetaminophen equals serious liver risk together. Alternative number 2, topical anti-inflammatory creams and gels. You apply directly on the painful area only. Smart approach. These contain same medicine as pills sometimes, but go straight to pain source. Very little enters your bloodstream overall, so your heart and kidneys don't get exposed to high levels. Much safer for people over 60 generally. In Japan, we use these topicals very commonly for elderly patients. Works well for arthritis and muscle pain especially. Alternative number 3, heat therapy. Simple but incredibly effective for many types of chronic pain, often underestimated by people. Heat increases blood flow to painful area, relaxes tight muscles, reduces stiffness, all without any medication at all. Use heating pad 20 minutes, 2 or 3 times daily, for back pain, knee pain, shoulder pain. Try this first. Alternative number 4, gentle movement and stretching. I know pain makes you want to stay still completely, but that's a mistake. When you don't move, joints get stiffer, muscles get weaker. Pain actually gets worse over time. Vicious cycle happens. Gentle movement keeps joints lubricated, maintains muscle strength, often reduces pain better than pills long term. Scientific fact. In Japanese elderly care, we emphasize daily movement. Even just 10 minutes walking makes enormous difference over months. Now I know what you're thinking. But Dr. Kenzo, my pain is real. I need something that works now. I understand completely. Pain is not in your head. It's real. And you deserve relief. I'm not saying suffer. What I'm saying is this. Combine multiple approaches instead of relying only on one dangerous pill every day. Use acetaminophen when needed. Apply topical cream. Use heat. Do gentle stretches. This combination works better than pills alone. And here's the important part many people miss. Rotate your methods. Don't use same thing every single day. Monday, acetaminophen and heat. Tuesday, topical cream and stretching. Wednesday, just heat and movement. You understand the pattern? This way your body doesn't build tolerance. And you're not exposing yourself to same chemical every day continuously. But I need to be honest with you about something important. Sometimes you absolutely must take NSAIDs temporarily. Severe flare-up of arthritis, dental procedure, injury. In these cases, short-term use is okay usually, not the problem. The problem is chronic daily use for months and years. That's when heart risk accumulates dangerously high over time. So if you must take NSAIDs sometimes, let me give you protocol to minimize the risk as much as possible. Rule number 1. Always take the lowest dose that actually controls your pain. Don't take more than you need. Many people think more medicine equals better results. Wrong. More medicine equals more side effects without extra benefit often. Rule number 2. Take it for shortest time possible. Days, not weeks. Weeks, not months. Stop when pain improves. Don't continue taking pills just because the bottle isn't empty yet. That's not good reason at all. Rule number 3. Never take NSAIDs on empty stomach. Always eat something first, even just piece of bread. Empty stomach plus NSAIDs can damage stomach lining, cause ulcers and bleeding, especially in people over 60. Very common problem. Rule number 4. Monitor your blood pressure weekly if you take NSAIDs regularly. This is absolutely critical step. These pills can raise your blood pressure within just few days of starting them. Silent and dangerous if unnoticed. If your blood pressure goes up more than 10 points systolic, stop the pills. Talk to your doctor immediately. Rule number 5. Watch for warning signs your body gives you. Don't ignore them, even if they seem minor. Swelling in your ankles or feet? That's fluid retention. Sign the pills are affecting your heart and kidneys already. Shortness of breath when you climb stairs or walk? Could be sign your heart is struggling with extra work. Irregular heartbeat? Feeling like your heart skips beats or races suddenly? Stop pills. See doctor same day. Dark or bloody stools? Stomach pain? These are signs of internal bleeding. Emergency. Go to hospital right away. Now here's the most important rule of all. Rule number 6. If you have existing heart disease, be extra careful. Had heart attack before? Heart failure? Stents? Bypass surgery? Talk to cardiologist before taking any NSAIDs at all. For you, even short-term use can be very dangerous. Risk is much higher than general population. Not worth it. Your cardiologist might say absolutely no NSAIDs ever, or might say okay only in specific emergency with close monitoring. Same applies if you take blood thinners like warfarin or other anticoagulants. Dangerous combination with NSAIDs. Bleeding risk. Let me give you a practical action plan you can start this week. Real steps, not just theory and information. Step 1. Go through your medicine cabinet right now. Make list of every pill you take, including over-the-counter medicines. Write down name of medication, dose, and how often you take it. Be honest. Don't guess. Check the labels. Step 2. Schedule appointment with your doctor specifically to discuss your pain medications and heart health together. Very important. Don't just mention it during regular checkup for something else. Make this the main topic of visit. Dedicated time needed. Bring your medication list with you. Show doctor everything. Ask, are these safe for my heart at my age? Step 3. Don't stop any medication suddenly without medical guidance. Even if you're worried now, this is critical safety point. Stopping some medications suddenly can cause rebound effects, make pain worse temporarily, or cause other problems. Taper off safely. Work with your doctor to create transition plan. Slowly reduce NSAID dose while starting safer alternatives at same time. Step 4. Start trying the alternatives I showed you today. Don't wait for perfect plan. Begin with something simple. Buy a heating pad if you don't have one. They're inexpensive. Use it tonight on your most painful area. See how it feels. Or get topical anti-inflammatory gel from pharmacy. No prescription needed usually. Apply it 3 times today. Give it chance. Try 5 minutes of gentle stretching in morning. Just 5 minutes. YouTube has hundreds of videos for elderly people. Free. Small actions create big results over time. This is Japanese philosophy, Kaizen. Continuous small improvements daily. Very powerful approach. Step 5. Keep pain diary for 2 weeks. Write down pain level 1 to 10 every day. What you tried. What helped. This gives you data, not just feelings. You can see patterns. What actually works for your specific body and pain. Maybe you discover heat works better in morning. Topicals better in evening. Everyone is different. Find your personal pattern. Bring this diary to your doctor appointment. Shows you're serious. Helps doctor make better recommendations for you specifically. Now, let me address something I hear very often from patients. But Dr. Kenzo, natural remedies don't work fast enough. You're right. They don't work instantly like strong pill does. That's actually the point here. Different approach entirely. Pills give you quick relief, but with hidden costs to your body. Alternatives give slower relief, but build long-term health. Think of it like this. Pills are like taking loan from your future health. You feel better now, pay later. Natural approaches are like investing in your health. Takes time, but you build equity. Compound interest over years. Better outcome. In Japan, we have a saying, the patient man eats ripe fruit. The impatient man eats stomachache. Very true. Another concern I hear. My pain is too severe for gentle approaches. I need strong medication or cannot function. If your pain is that severe every single day, you need to find the root cause. Not just cover it forever. Chronic severe pain is your body's alarm system, screaming something is seriously wrong. Don't just silence the alarm permanently. See specialist. Get imaging if needed. Physical therapy evaluation. Sometimes there's fixable problem you haven't discovered yet. Worth investigating. Had patient last year. 74 years old. Took ibuprofen daily for 8 years for back pain. Accepted it. Finally got MRI. Discovered compressed nerve that could be treated with simple injection. Pain reduced 80% in 2 weeks. 8 years of daily NSAIDs. 8 years of heart risk. All because nobody looked deeper for actual cause. Sad, but common. Don't let this be your story. If you have chronic pain, demand thorough investigation. You deserve answers and real solutions. Now I want to talk about something very important for people who live alone. You need accountability partner here. Ask family member or close friend to check on you weekly. Did you monitor blood pressure? Any swelling? Feeling okay? Sometimes we don't notice gradual changes in ourselves. Others can see what we miss. Extra eyes are a valuable safety net. If you live completely alone with no close contacts, consider joining senior center or community group. Make connections now. Health is not just about pills and doctors. It's also about human connection and support system around you. In Japan, we emphasize this strongly. Elderly people who have social connections live longer, healthier, happier. Research proves it. Let me give you some specific numbers so you understand the scope of this problem worldwide. Very eye-opening statistics. In United States alone, over 15 million people over 65 take NSAIDs daily. Most don't know the risks. Studies estimate these pills contribute to 16,000 deaths per year from heart complications. Preventable deaths. Tragic numbers. That's more than car accidents in some countries. but nobody talks about it. No headlines, no warnings on TV. Why? Because these are over-the-counter medications. People think if you can buy without prescription, must be completely safe. Wrong assumption. Many over-the-counter drugs are powerful chemicals with real side effects, especially for elderly bodies. Be careful. Here's what frustrates me most as doctor. This information is not new at all. We've known this for years. FDA put warning labels on NSAIDs in 2015, 10 years ago. How many people actually read those labels? The warning says clearly, may increase risk of heart attack and stroke, can be fatal. Right there in writing. But labels use tiny font, medical language, buried in paragraphs. Most people never read it, or don't understand importance. This is why I make videos like this, to translate medical information into language real people can understand and use. You deserve to know what you're putting in your body, what risks you're taking, what alternatives exist. This is basic right.